Hi guys, I'm Dr. Carrie. Thank you so much for coming to hang out with me on this week's Vet Ranch Roundup. These two, who deserve to be in the shot, oh gosh, he looks so aggravated. This is Squeaky, who's laughing at his brother, and this is Kiki, who's not pumped about having a bandana on, but they had photo shoots. But if you don't know who they are, then you need to get caught up on videos. And so I'm gonna post a couple playlists that you can binge watch and then kind of get up to speed with all of our patients. We also have regular videos. I call them regular, but basically single case videos of each animal as well, each intensive case that we see. So you check out those also. And consider subscribing, please. And turn on your alerts so that you can stay up to date with our content, and I hope you enjoy. But anyway, let's just pop to the back and see what we need to do. I know we need to vaccinate the pig, which I don't want to do because it's always sad. But let's go.
I feel like you could almost vaccinate her while she's doing that.
Is she gonna eat that? Oh, likes ice cream. No, put that down. This is Shelby trying to grab a pig.
You're grabbing her. Are you giving it?
Well, no, I don't want to give it. I'm not going to poke her. I'm so sorry. Here.
She's like, okay, she's fine. Okay, yeah. It's hard for me to realize how much she's grown until I see her next to the watermelon bed.
Yeah. But still, she's really cute.
What a big girl. She's quick to forgive, isn't she?
Yeah, because I gave her maters.
Hi, you guys are dirty stinky. These puppies were listed as 6 months old. They're more like 4 weeks, 5 weeks. We're waiting for you guys to name them on Facebook because
One girl, three boys.
One girl, three boys, but we're calling them the nasty puppies, which is not nice. So we need you guys 3.2.
Really?
Yeah, it's good. It's like a girl. So there's one girl, three boys. This is the girl. So what we're gonna do is deworm them. We have a stool sample running. They already got vaccines a couple days ago. They're so little. And then microchip them so we can keep track of them. And then we're gonna bathe them so we can stop calling them nasty puppies. Stop calling them that, and then we can snuggle. They're cute. They have long noses. They're cute puppies. I'm really worried about infectious disease when there's like 5-week-old puppies that have been in the shelter for 4 days. It's kind of a waiting game for the next 10 to 14 days to see if they break with something.
That's fun.
I thought you were hungry. Oh, get hungry. Are you opening food and teasing? 3 pounds.
That one's the yummy one. This one, oh dear, sorry about your panic here. I don't care.
This is your Vet Ranch tip of the week. If you have multiple puppies eating out of the same dish, put them on this little circular thing. Because I don't know why they like to just all try to eat out of the same bowl. And these puppies are super dehydrated because at the shelter they just put them in a big run and then put food down. And there's no oversight to see if they're eating or anything. Oh goodness!
Oh, yeah, that's what we like.
It. Right there. Here is Nasty Puppies stool sample, tons and tons of hookworms. And one of those white liquids was for hookworms that we gave, the other for coccidia. So we kind of have that covered. We'll give 2 more doses.
This little dude has a hernia.
Oh, there's
Sticking
a little
out.
hernia. Boop. Oh, it goes away.
Yeah, it does.
Now it'll be coming back. There it is. Here's another hernia on the puppy. Just an umbilical hernia, and you can see like it goes away. You can reduce it, and then it comes back out, just a little bit of fat. May resolve. If not, we'll fix it. Oh my gosh! I was like, why does it keep coming out? He's like, stop doing that to me, please. Happy has a prednisone body. Let's weigh him in. Don't you think he's gained weight, Wendy?
Oh yeah.
Oh my goodness, sir. Oh my goodness. He's like, but I feel so good. Aww. He's got the cutest face. Let's weigh him real quick and see. Oh my god, what was he?
He was like right under 10. I think.
Sir. He's like, I feel so good. Well, we're gonna have to cut your food down, buddy. You're just...
It's probably because I give him meatballs with the pills.
Yeah, maybe. Of what? Oh, look at him. He's like, is that food?
Okay.
Oh, good job, Herpy.
It's a left atrial aorta, so good. And here's the problem. This is main pulmonary artery with a bunch of heart murmurs right there. It's a right pulmonary artery. You can see what's in it.
It's those little white things, huh?
No, it's a lot of those. So give those injections, some of them die, go flying out of his lungs and cause a few problems.
Time for boosters for our eye puppies. So the ones that are still here. Iris is gone, got adopted. They're finishing her stuff closer to where they live because they live out of town. And so we're gonna go ahead and do the next round of vaccines on the 4 that we have here. And then Danielle, the receptionist, took one home overnight, so we'll do her tomorrow. Okay, this is Megan's dog. Here we go, here's the special treatment. Time for boosters. Oh, super nice! My littlest man. And then we're getting a puppy photo shoot going too. New picture.
He's so
Good
good.
for you. You just get 1,000 pictures a day anyway.
Yeah. Oh my gosh, I love him.
I want to get a picture, but the videos are just too cute. We did the babies. We're having a photo shoot. We're having a photo shoot. Oh my goodness.
I'm trying to get your ears up. It's not working.
I was getting a video of that just to show the sounds you make. Now is the time where these little kitties are growing so fast. They're real kittens now. Oh my goodness. You guys want to come play? Proud mama. Oh God. Recheck on May. We're going to remove the purse string sutures in her little vulva. Oh goodness, her hair's starting to grow back. And then we'll give her a medicated bath and then spay her tomorrow. Have to get one little grab. What's the best? You're the bestest girl. But that doesn't help. Her tail's like,
She said, "Ooh,
did it. But that didn't feel so great, though, huh?
not nice."
There you go. So back, stay tomorrow.
Bath and spay. Woo!
She is so cute. She's like a Muppet. These are like young dog teeth. Okay. Ah. Because she was going to be euthanized today. She's going to be transported specifically to Oregon, and they have named her Nina. So we're going to do her full heartworm test, stool check, and vaccines right now, and hopefully she's heartworm negative. And we can get her spayed, and then in a couple weeks, get her on the road.
On the road.
No,
I'm
and
a good girl. You have good blood pressure? Oh, yeah.
Oh, goodness. Oh, goodness. Let's age you as well.
Look at that doodle plot right there. Ooh.
I know, right? I'm sorry. Maybe I feel like I pulled her little whiskers accidentally. My gloves. So she is probably 2. Oh, you're a baby. Here's Nina's stool sample, and she just has hookworms, so we are going to treat her with a powder dewormer on her food.
Are we going to be Dr. Judd and Dr. Perry again? Yeah. Hey, I'm Dr. Judd, and we had a client presenting this patient, 3-year-old healer named Misty, for aggressive issues with strangers in the home. She was dumped at their house about 3 years ago, and she, it's just very nervous dog, and has just been living in their backyard and not really getting the proper training and things that you need for a typical breed in this style. As you can see, she's pretty okay with me. I think that she will be a good fit for saving and potentially adopting out eventually. She's super sweet, just very shy, and hopefully we'll get her fixed right up and find her the perfect place to live forever.
Okay guys, so this is Misty, the new vet ranch patient. This is her heart test, which is negative, and her micropharia was negative as well, which is great.
Well, there you have it. That pretty much answers a lot of your questions, but this is one of those cases that makes rescue so worth it, because it just was not a good fit as a home for her. And it's okay to recognize that and realize that it's not the right home for the animal or for the owner, and it's not a good fit. And then that's where we can step in and help find a better home. But certainly euthanasia is not the answer. So we are so lucky to have her. Easily, hands down, 100% the best behaved dog that we have here. 100%. Misty. Good. You know your name. Come here. Misty. She's like, I gotta go potty. No, I mean, she shows she walks on a leash so good. I wish my dogs walked like that. Okay, this is the example of how they're
Such a good baby.
Look at this dog.
Let's go. Look at this dog. Just look at her. My dogs will be dragging me down. Not always, but a lot of times.
Look at her, see?
Oh my god. Oh my goodness. She's just a little nugget.
Oh, good girl. Oh, yes, you are. Oh, come on. Oh.
Such a good girl.
She's like, I don't think I'm supposed to do that.
But I like
But I like it. I like it. But I do it. Oh, yeah.
We're gonna find her the right home, a good fit.
Good fit. She's such a good
And
dog.
for a healer, no offense to people
Very
that love
sweet.
healers, but very sweet. They can be a little,
She's not a one-person dog.
nah, they
She
can
loves
talk
everybody.
back. They can be one person and they'll let you know when they're not happy about something. Look at that tail.
Two.
Well, we are spaying and neutering these dogs today because they have forever homes. This is a blooper reel. So as you can see, they don't know what's happening yet. Okay, that's it. We're spaying and neutering them. After surgery as they were 2 hours ago. Crazy. Booster for Ricky. Sweetest Bowie. We need to look at his skin. It's really flaky. So we need to start shampooing it. Let me tell you. Probably because he's had a lifetime of fleas. So we're gonna start some medicated baths. He feels a little oily. Look at all these calluses.
There's lesions of that.
Just a life outside.
Oh, he says, I just saw a cat. There's a cat over there.
Did you see a kitty cat? You can't have kitty cats. I bet you would. No kitty cat. What are you saying? You can't have a kitty cat. No. He just looked at himself.
That's one. That's a handsome dog right there.
This little waggy dog is, well, April named him Voorhees, because he came in Friday the 13th. Oh wait, she came in Friday the 13th, which makes the name even better. Hold on. The shelter emailed and said, are you going TT? I'm sorry. She's super sweet. The shelter emailed and said she possibly jumped from a truck. They weren't really sure, and I don't know how they came about that information. Oh, got her toe first. That's like a girl. Look at her tail. God, so cute. Look at it. So she is limping pretty bad on this leg, so we're going to take some x-rays and see what we find. And then do her intake vaccines and shave off this little spot she has. Yeah. She's not really using this leg much, and I'll show you. We'll walk her around. Come on. Okay, so here's one of the radiographs on Voorhees, and this seems like Voorhees/Friday. Now that we don't like that name, I can't stop saying it. But this is where she seems to be most painful. This looks a little irregular here to me on the surface. Oops, I'm kind of way zoomed in. But this is the femur, tibia, and then I just noticed this little section here that almost looks like a little chip fracture. See right there, and that looks like it went there, but we're gonna send those to a radiologist and see what they think as well. And then try to get a plan together to see if this is something that's gonna heal on its own or if we need to think about surgery. Well, here's a new guy. The shelter emailed me. Voorhees wants all the Levins. We're calling her Friday now. Sorry, April. But this dog has no foot. It looks like maybe it was a strangulating lesion and happy dog. It was a strangulating lesion and maybe the dog was stuck somewhere and then chewed its own foot off to get away. I don't know. It's phenomenal how sweet this dog is, but we're probably gonna go ahead and get him under anesthesia pretty quickly. We're gonna have some pain meds, and that way we can assess what's going on, and obviously probably gonna lose the leg.
Your boy. You got balls.
Baby, how are you just hanging out?
My foot hurts a little.
Don't eat your foot.
Don't eat your foot anymore.
Baby.
Good job,
How are
buddy.
dogs so tolerant? Newest guy from the shelter. He's just a gentle soul.
I know. He probably had his leg caught in something, so he chewed it off so he could get free. No, this is looking that free.
Why is he so sweet?
So you thought you gonna save me. Yay.
Okay, fix me now. I'm gonna call him Stallone. Can somebody do a Sylvester Stallone accent? Adrian! Go, Adrian!
Have we just bandaged him all before?
Yes. Oh, I can't with him doing that. Oh my God.
Face, he's so embarrassed. That's part of his story.
So sad. He threw up part of his foot.
Don't vomit.
I'm not.
Poor Boo. That's desperation right there.
Oh,
That's so sad.
it really is.
I believe you. He ate his paw pad.
Let's show.
So you think he got it stuck and strangled and had to
He
eat
got
it
it
to get
stuck in
out?
something. He had to chew his foot off. Too.
There
Buddy.
is part of the paw pad right there.
He's like, not for
Ew.
me. Look where I'm at. All these ladies love me.
You know what makes me feel good about it? This is what makes me feel good about it. If he just vomited it up, at least it chewed off not that long ago, and now he's here
Yeah.
getting treatment.
You right?
True.
He hasn't been hobbling around like this
Come
for
on,
too long.
silver lining, people.
Why are you so cute?
He's so sweet.
He's like, I'm feeling a little weird right now. Little stone. bit. We're gonna keep him gorked overnight on the pain med drip, and then try to get him up and moving around tomorrow. Poor guy.
Come on, Stallone! Hello, we are here with Stallone. Looking great. Come here, buddy. Looking excellent. We're about 24 hours, not quite post-op. So we did his surgery yesterday about noon, and it's today about 8:30. But you're watching this at a different time. So today's not your today, today's my today. Think about that. But we did the procedure about 20 hours ago, and everything looks really good. Not a lot of significant inflammation. We're gonna wean him off pain meds this morning, which is great. His neuter site, which you can't see right now, also looks excellent. Not sure who named this guy Stallone, but just love it. Super friendly guy. And so what we're gonna do is wean him off the meds, keep the antibiotics going, and just enjoy him. Sometimes these guys, you just gotta get it on the books to enjoy them. And so hopefully we're gonna let him hang out with us and get to know Stallone a little bit better. He's already making me feel important.
Oh my gosh.
And that's only because it's Dr. Carey's day off. Here's the deal. When I'm around dogs and Carey's around animals, I'm like a second fiddle. But today with Stallone, I'm the main show, which is great, because that doesn't happen because they love her so much. So that's about it. Great update. We'll see you on the flip side.
Insane. Well, we've got another week on the books of doing what we love. Thank you guys so much for all your support. We wouldn't be here doing this if it wasn't for you and your donations and just sharing the word about our message and what we try to do. So thank you so much. And I'm gonna leave you with an update on the dogs that transported last week. We've gotten lots of responses from some that are adopted and some that are doing fabulous in their foster homes. So we will show you those now, and I'll see you guys next week. Bye.